Welcome to a new to Medicare presentation. What is Medicare? Medicare is a federal hospitalization, medical, and prescription drug insurance program. Medicare eligibility: legal permanent resident of the United States for at least 5 continuous years prior to enrollment, receiving Social Security disability income for 24 months, end-stage renal disease, or ALS. The Social Security Administration determines entitlement to Medicare, enroll in Part A and B, change of address, replace lost Medicare card, deductions from Social Security check for Medicare Part B and or Part D premium. These are your local Social Security Administration offices. 1-866-690-1944 is Rutland, Vermont office. 1-877-505-4542 is the Montpelier office. 1-877-840-5776 is the Burlington office, or ssa.gov. Here's a look at what your Medicare card will look like. Let your doctor, hospital, or healthcare provider see your card when you need healthcare. Medicare enrollment: must voluntarily enroll during an official Medicare enrollment period. Some individuals are automatically enrolled before age 65 if you are already receiving retirement or disability benefits. Initial enrollment period: the effective date of Medicare coverage is based on when you enroll. Take action to enroll in Medicare. If you aren't automatically enrolled in Part A and Part B and you want it, you need to enroll with Social Security. You can visit socialsecurity.gov or call the national number 1-800-772-1213 or the number I provided for the local offices previous slides. Automatic enrollment: you'll receive this card automatically within 3 months of the effective date. Keep it to accept Part B. To refuse Part B, follow the instructions in the Welcome to Medicare package. This is important to read. Carry your card when you're away from home. Special enrollment period: 8-month period when you can enroll. Part A, Part B. If you enroll during a special enrollment period, you can enroll in an Advantage plan or a drug plan. You have 6 months from the Part B effective date to buy a Medigap policy, but you must have A and Part B. 2 paths to Medicare: original Medicare with a Medigap and a Medicare drug plan, or a Medicare Advantage plan, which is also known as Part C, which do include Medicare prescription Part D insurance as well. Your options recap from the previous slide. Original Medicare, Part A, Part B. You can add Part D. You can also add a supplemental coverage, which is also known as a Medigap. Or you can choose to enroll in a Medicare Advantage plan, also known as a Part C. And most plans include a Part D, and they also can have extra benefits. Part A, original Medicare Part A hospital coverage. Let's take a closer look at Part A. Part A helps pay for the following services when deemed medically necessary: inpatient hospital care, blood after 3 pints, skilled nursing facility, home health services, which can be limited, and hospice care. Original Medicare Part A coverage and costs for 2021. Part A premium free for most people. The benefit period deductible for 2021 is $1,484. There is additional co-payments after 60 days of inpatient coverage, different costs for other Part A services. What's a benefit period? Part A. Benefit period deductible is $1,484. Part A out-of-pocket costs. Hospital inpatient. As I said, $1,484 for the deductible. That's days 1 through 60. Then there's co-insurances for days 61 through 90, as well as days 91 through 150. Skilled nursing facility pays up to 100% coverage days 1 through 20 after 3 overnight stays in a hospital. And then you have a co-insurance of $185.50 a day, days 21 through 100. Home health care and hospice covered as long as qualified. Part B. If you are 65 or older and covered by employer group health plan because you or a spouse, any age, are working, you may delay Part B if the group health plan has 20 or more employees or 100 employees for someone under 65 and disabled. Special enrollment period to sign up for Part B without penalty for up to 8 months after your employment ends. General enrollment period for Part B is January through March each year, and the coverage will begin July 1st. Late enrollment penalty, 10% increase to the cost of Part B for each 12 months period. You could have had Part B, but didn't sign up for it. Original Medicare Part B. Medicare Part B helps cover services from doctors and other healthcare providers, outpatient hospital care, home health care that Part A does not cover, durable medical equipment, some preventive services, and other medical services. Original Part B costs for 2021, about 72% of beneficiaries will pay $148.50 per month for Part B. The annual deductible for Part B is $203. There's a 20% coinsurance for most Part B services. Individuals with income above $88,000 for a single person and above $176,000 for a couple will have a higher B premium. Social Security Administration will let you know what your B premium will be. Original Medicare and Medigap, also known as a Medicare supplement plan. Original Medicare pays for many healthcare services and supplies, but it doesn't pay all of a person's healthcare cost. A Medigap policy is a supplement insurance sold by private insurance companies to bridge the cost in coverage under Original Medicare, such as deductibles, coinsurance, and co-payments. They do not offer additional health coverage, only the costs associated with Medicare or foreign travel emergencies. Medicare supplement plans, 4 basic plans, for basic benefits. Part A, hospital co-payments and coinsurance. Part A, hospice care, co-payments and coinsurance. Part B, co-payments and coinsurance. The first 3 pints of blood per year. A Medigap policy must be one of 10 standardized plan types. Each plan type has a different set of benefits. No matter which insurance company is offering these standardized plans, the coverage is the same. However, it is important to compare plans because costs vary to certain parameters. For example, Plan A is offered by Company X and Company Y in the same zip code. Both policies offer the exact same coverage, but at different premiums. Here is the chart on how to read and compare Medigap plans. This page is always located in the Medicare and You booklet that is published every year. You will receive a copy each September. You can also find this at medicare.gov. Any Medicare beneficiary who is enrolled in Original Medicare and has both A and B is eligible for Medigap. The best time to buy a Medigap policy is during the Medigap open enrollment period, when you have the right to buy any of the 10 different Medigap policies offered in the state. This enrollment period begins the month the beneficiary is enrolled in both parts A and B and lasts 6 months. Even if you are in your open enrollment period, there are several situations in which you may still have a guarantee right to buy a Medigap policy. Guarantee issue means that you cannot be denied a policy or charged more due to a pre-existing condition. You can enroll anytime, but if you miss the Medigap open enrollment period, you may not have guarantee issue rights and could be denied a policy or charged more for a pre-existing condition. Here's our recap. I will not read this all, but we will probably be able to send this information to you. Again, all this information is in the Medicare and You booklet and at medicare.gov. Part D for drug. Part D prescription drug coverage. You may need a standalone prescription drug plan to cover your medications. This is known as Medicare Part D. Part D plans are available through an insurance company that contracts with Medicare. Most plans include a monthly premium and deductible. Drug costs are shared by the plan and the beneficiary. Again, to go over it, monthly premium, and they vary from individual plans. The annual deductible for 2021 is no more than $445, and some plans have no deductible. Medicare Advantage plans. Medicare Advantage plans are bundled policies. Members usually get all their Medicare covered health care under that single plan, including hospital, medical, and prescription drug coverage. People may need to use specific doctors that accept the plan or go to certain network hospitals to get covered services. Because all Advantage plan members are still receiving Medicare coverage, they are responsible for paying the Part B premium. Depending on the specific Advantage plan, members may have to pay other costs, such as additional premiums, co-payments, or co-insurance for their covered services. The plan may offer extra benefits such as coverage for vision, hearing, dental care, or health and wellness programs. There are 4 main types of Medicare Advantage plans: an HMO, a PPO, PFFS, and an SNP. Vermont does not offer Special Needs Plan, also known as SNP. Please refer to medicare.gov, your Medicare New booklet, or you can call our office to discuss the differences between all of these plans. Yearly open enrollment period starts October 15th and ends December 7th, and the new coverage or the coverage begins January 1st. It's a 7-week period each year where you can enroll in, disenroll, or switch your drug plan or your Advantage plan. This is a time to review health and drug plan choices. Get help from local SHIP program by calling us at 1-800-642-5119. Create a Medicare.gov online account to review yourself, or call 1-800-MEDICARE for the assistance. There is financial assistance programs offered in the state of Vermont, federal and state programs. There's low income subsidy, which is also known as extra help, provides to help with limited income and resources pay for prescription drug costs. State Pharmacy Assistance Program, that is known as VPharm, wraps around Medicare Part D to help for paying for prescription drug costs. The Medicare Savings Program is a Medicaid program that helps people with limited income pay for some or all of the Medicare premiums, deductibles, and co-payments, and then, of course, community Medicaid. Extra help, also known as low-income subsidy. People with lowest income and assets pay no premiums or deductibles, have smaller no co-payments, and those with slightly higher income and assets pay reduced or no premium, have a lower deductible, and pay a little more out of pocket. You can apply online at ssa.gov, over the phone, or mail in a paper application to SSA. You can also call our agency at 1-800-642-5119 to be screened for this program and to get assistance with the application. Medicare Savings Programs. The Medicare Savings Programs are part of the National Medicaid program and are designed to help beneficiaries with an income that does not exceed 135% of the federal poverty level. The ones here are SLMB, also known as SLMB, QMB, QMB, QI1, and these programs pay the Part B premium. The State Health Insurance Assistance Program is a program through all of the Council on Aging's, the area agencies in Vermont, by calling 1-800-642-5119. You can get free and confidential Medicare counseling, assistance in applying for the programs such as Medicaid, Medicare Savings Program, Extra Help, which these will help you reduce your Medicare cost. Thank you for attending. This publication has been created by Vermont SHIP with financial assistance from the Administration for Community Living. The contents, therefore, do not necessarily represent official ACL policy. Please call us at 1-800-642-5119 for assistance. Thank you for attending.